Hello everyone, I am Dr. Dinesh Khullar, Chairman, Nephrology and Renal Transplant Medicine at Max Super Speciality Hospital, Saket, New Delhi. Well, chronic kidney disease is a big problem the world over and India is no exception. If you come to think of it, it is generally believed about 10 to 16% of the Indian population is suffering from some degree of chronic kidney disease, which translates into something as high as 13 crore of Indian population. 130 million population of India could be having some form of chronic kidney disease. If you talk about diabetics, it's generally estimated close to 80 million people in India are suffering from diabetes, and roughly about 40% of these are believed to have significantly advanced chronic kidney disease, which means close to 3.5 crore of Indian population has what is called diabetic kidney disease. And we also know that almost about 2.5 lakh of Indians finally land up in the stage of requiring renal replacement therapy every year. And this is not a small number going by the economic resources of our country. So obviously we want to catch them young, we want to prevent the chronic kidney disease evolution so that not too many people reach the stage of requiring renal replacement therapy. Once the patient reaches the stage of end-stage kidney disease, the only two ways of his or her survival are going to be dependent either on lifelong dialysis or kidney transplantation. We all know that kidney transplantation is the preferred modality wherever feasible because it gives almost back to normal quality of life. However, transplantation has its own problems. The availability of donor, that's the biggest problem which we currently face, and that is why majority of these patients who require renal replacement therapy are going to be offered dialysis. Now, we also know that dialysis is of two types. One is hemodialysis, whereby the blood is drawn out of the body, passed through a dialysis machine, the toxins removed, and the same blood put back into the patient's body. For this, patient has to go to the hospital 2 to 3 times in a week, and each session takes about 4 hours. So there are practical issues. There are also issues of the availability of good quality hemodialysis across the country, and especially it matters more in the far-flung areas where the healthcare system may not be as robust. So here, peritoneal dialysis can be viewed as a big savior, because peritoneal dialysis is something whereby a catheter is placed in the patient's peritoneal abdominal cavity, and all that you have to do is instill a special kind of peritoneal dialysis fluid into the peritoneal cavity and take it out after a few hours. This typically takes about 25 to 30 minutes each time and is done about 3 to 4 times a day. But the important thing is it can be done by the patient himself or herself, can be done by one of the family members, and it can be done in the convenience of the patient's own place. We need to percolate into those areas where people may not have access to hemodialysis for almost like 100 to 200 kilometers, which they have to travel 2 to 3 times in a week to gain access to hemodialysis. Forget about quality dialysis. So on one hand, we need to increase the number of dialysis centers across the country, and government deserves a lot of credit because they are moving in the right direction doing exactly that. At the same time, we have to be mindful of the quality of dialysis, and we can now, as I say, take pride in the fact that it's not just offering dialysis to our patients. We are now talking about more and more about offering quality dialysis to our patients so that they can live for long. So we need to have the access improved. We have to disseminate adequate knowledge, and we have to take care of the resources, involve the governmental agencies as well as insurance companies to take good care of our patients so that economically they can move forward much more conveniently. If we talk about the advancements in the field of dialysis, again, it's been quite a good and welcome news as far as the patients and the treating nephrologists are concerned. Gone are the days of poor quality dialysis. We always believed that the good quality water is an integral part of high quality dialysis. And I'm pleased to say that more and more centers are accepting the importance of water quality, and lot of emphasis is being given to the same. When we talk of the advancements in the hemodialysis, on the hemodialysis side, well, we have what is available in the more developed countries as well, which means the concepts of it's not just hemodialysis, we are offering the concepts like hemodiafiltration to our patients, which is top quality dialysis being accepted the world over, and that certainly has vastly improved the quality of life of our patients. Coming now to peritoneal dialysis. When it was launched in this country way back in the 90s of the last century, we could see the evolution from what was called a straight line set to an O set to a Y set to finally the twin bags, which became available by the turn of the century and have really been a great boon to the patients who have been initiating on peritoneal dialysis, and this is probably one of the main reasons why the survival has vastly improved. So this is where we need to help them. This is where government has to step in. This is where the insurance companies have to set in. Patients need to become more and more aware of getting themselves insured at the right time. They also, of course, they have already missed the bus by not taking good care of their health. That is why they landed up in end-stage kidney disease. So forget about that now. Let's move on and say that, okay, if that unfortunate thing has already happened, which puts them in a stage of requiring renal replacement therapy, I think a proper planning at the right time is what matters the most. When we talk about insurance in the case of patients requiring dialysis, at times we find it quite strange that the hemodialysis expenses are reimbursable by most of the insurance companies, but unfortunately when it comes to reimbursement of the expenses while on peritoneal dialysis, many insurance companies do not do that, and that's for reasons best known to them. Even when we know it's a very genuine case, still there is some kind of apprehension on the part of the insurance companies, believing that a home-based therapy could actually exploit them. I think we need to have better policies whereby the genuine patients do not suffer just because the insurance companies do not reimburse their medical treatment.